I do feel like the healthcare climate is changing though. Like they're realizing it doesn't take all of that to be a primary care. Like you can really do it as a nurse and have great results and have outcomes that are beyond, even higher in some cases than doctors as a nurse practitioner. Hey, 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 and welcome to the Nurse Boss Shift, you guys. It's been a while. It's your girl, Dr. Kiiyonna Jones.
And I'm Crystal P, the Beauty NP.
And we are super excited about this topic today. It was breaking news for a good 2 weeks in the social media streets, in the news streets. And the topic was nurses being called doctors. And so, should they be called doctors? And in the state of California, there's a big lawsuit that was filed back in June. And so we are going to discuss that today.
Yeah.
So Crystal, really quickly, we're in Cali. We're from Cali. So let's kind of talk about, based on our own experiences, this whole doctor nurse thing. Because you've been a nurse for a while. I've been a nurse for a while. Have you noticed any type of like friction or any challenges in the healthcare settings that you have worked in regarding like nurses being called doctors?
So I won't say that there has been any friction. For the majority of my career, I worked in the emergency room. So we had nurse practitioners in the front seeing the patients, the quick fast track patients. But none of them were in the back. So they kind of did their own thing. Doctors did their own thing. So there was never any like turmoil, I guess, between them. I've just always heard about the issue of nurses calling themselves doctor and how doctors were upset because we are using the word doctor. So I've always heard about it. I haven't personally experienced it. Now in the cath lab, we do have a nurse practitioner who's very, very one-on-one, but she definitely alerts that she's a nurse practitioner. So it's one of those things. Definitely heard about rumblings that MD had an issue with us calling ourselves doctors or presenting ourselves as doctors. So it's funny to see, and that's been years. So it's like the same thing is still coming around years later.
Yeah, it's funny.
Yeah.
I remember. So first of all, nurses have been being called doctors for a very long time, just not in the clinical setting. There was not a clinical track for nurses who were interested in this terminal degree. Usually it stopped at like nurse practitioner, right? And then if you wanted to get an advanced degree, you would go back and get your PhD. So that was really where it ended. So DNP, I remember in 2006 when I was in nursing school, it was this big conversation about doctor nurse. Like, it was like articles released and just talking about this new doctor nurse, because now the nurses would be doctor DNP, Doctor of Nursing Practice, and they would be in the clinical settings with the doctors. And so there was a little controversy back then. And again, I went to UCLA, so we were here in Cali, which is one of the most strict states. So that was always there, but I first of all, so there wasn't a lot when I graduated. I graduated in 2008, and there was not any nurses that had completed their like DNP yet, because those programs had just started. And so I don't recall there being ever any friction per se, because anytime you referred to one of your professors, it was like in an academic setting, right? Or a research setting. And so it didn't matter. So now, like looking back, I'm like, I feel like they were already trying to kind of limit us with this even back in 2008. So now you have this nurse, which shout out to her. She's Jacqueline Palmer, you guys. She's from Palmdale, California. Her and two other nurse practitioners, DNP prepared nurses, Heather Lewis and Rodolfo Hansen, came together, and they were all DNPs, and they were like, doctors don't own the word doctor, like medical doctors don't own it. But in the state of California, The medical board says that they do. And so what I like about the situation, I have varying, like, even though I'm a nurse and I'm a PhD prepared nurse, and I refer to myself as Dr. Jones, I usually, when I introduce myself, I say I'm a doctoral prepared nurse. I don't usually, like, if I'm talking and I like third person myself, like, oh, Dr. Jones, but everybody knows I'm a nurse practitioner. And I think that the biggest issue with that is that the public, what can we do to make sure that the public does not get confused in these clinical settings? And I don't know. I really have mixed feelings because I understand it. And then again, from the public's perspective, but then again, I do feel like, why can't you be called? But then again, it's I think it's the weight that it holds. It's like I think we put uh that level of a notoriety on the word doctor, and that's why we so much, like, that's why we want to be called that so much, because it gives us a level of esteem or honor or something like that. Like, what do you think?
Yeah, and I think it is the highest honor or the highest degree. So everyone should have that right to be called that if that's what they received.
Mm-hmm.
And my first thought is like, we're nurses. We ain't trying to be doctors. Like, we're not trying to out here like doctors. We know we're nurses. But then I have to think about the people who probably do get that ego, or they think they are now a medical doctor because they have a doctorate. And that's where it's like, okay, we do need to make sure it's clear for those people like that who we all know. So it definitely needs to be clear, and it needs to be made clear to the public how the two are distinguished.
Yeah.
But then it's like, we think about all these other specialties that call themselves doctors. So it's like why is that looked so down upon on the nurse? And I guess it's because, thinking about it now, is because we are so close in the clinical setting with the physician. Right. So that's why, like, well, we have to make that distinction, but it still feels like another attack.
Yeah.
It still feels like,
it's like
some of those doctors have an issue with us being called the same thing as them, because there is that notoriety. But I'm sorry, sir, I went to school too and got this degree. So how am I any different, or I don't deserve to be called that because we work together? So we need to figure out a way to distinguish the two, versus you telling me that I have no rights to call myself that.
Right. And so this case kind of started back when there was a DNP, Sarah Erny. I think her name is Erny. She would refer to herself as Dr. Sarah. And so, long story, in the state of California, y'all know California always got to do the most with everything. So she was referring to herself as Dr. Sarah. Long story short, basically the department who would investigate any kind of complaint basically came to her medical practice, which is the state, came to her medical practice, and basically, long story short, that she settled out of court. She had to pay a couple fines, but she also had to pay $20,000 and was really at risk for losing her license. So the reason why this lawsuit came about was a direct result of that. And so what Jacqueline Palmer, who is like the number one plaintiff, what she said is that when that happened, she got extremely nervous. Like, she felt like, her business was at risk. She started telling the patients, like, don't call me doctor, just refer to me as Jacqueline or whatever, because she felt like she was, putting herself at risk. Now, California is the only state that is this strict with the term doctor. Okay. A lot of other states are okay with it. I was doing some research. There are a few states that were like trying to push back, like Florida was trying to push back and saying, like, trying to do basically what California is doing. And the governor DeSantis vetoed it. And so it didn't pass. And then Georgia was also kind of trying to do something similar. But what they did was they just said, like, you can use the word doctor, but you have to be clear of your credentials.
Right.
along with the doctor. So it's just, I find it very interesting that California, and I'm gonna say it, and I could be wrong, but I just feel like it comes from a paternalistic hierarchical mindset.
That,
Like,
mm,
I'm better than you, you're
right.
just a nurse.
That's
Like,
what it sounds feeling like.
yeah, yeah, and you just can't even get to my level, so like, don't try.
Right.
And like, we have to remind you, I really feel like, and I don't know, a part of me feels like super proud of Jacqueline and I'm sorry, Dr. Palmer, and the other two nurses for stepping up for us, because if we want to see change, it has to change at the legislative level. So a part of me like really truly appreciates this, but then a part of me is like, but what is, either one of two things are going to happen as a result of this. Either they're going to change it, and that's a great thing, or they're going to start scrutinizing us even more and put even more disclaimer criteria out there for us.
Right.
That's what I worry about.
Yeah.
And so, go ahead.
I was just gonna say, yeah, what are the implications of this and where does it go after?
Yeah.
And I like that Jacqueline heard the story, was like, wait a minute.
Right.
Wait a minute.
Right.
And it's taking one for the team
What
essentially,
does
because
it
that's
mean to you?
what.
But what does it mean to you? Like, to you, like how would you feel if you went to school? Would you want to be referred to as Dr. Parker? Like, what does it mean to you if you
Yeah.
like,
I definitely yeah, I would definitely, well, okay, so in the clinical I know that's kind of hard.
yeah.
I don't know.
Yeah.
I guess I don't know now, but after finishing all that work, yeah, I'm sure that I would want, that title, because I always think about going to school, and I always talk to you about, like, should I go back? One of the things is because my dad was Dr. Walker, so I'm like, I kind of want to like carry that on, but yeah, I would definitely feel like after I did all that work, I would want to be called that, especially like I said, since there's other practices who are allowed to, or, are okay with being called
Yeah.
doctor. I can't help that I work close with you.
Yeah.
I can't help we're in the same building. I will definitely distinguish that I am a registered nurse, have a nursing or a doctorate in nursing practice. I would definitely distinguish that. But yeah, I would want to be called, I will want to announce myself as my title, I would say, if I earned it. How about you, Dr. Jones?
You know what? I used to say, I don't care about the title as long as my check is right. That's what I used to say. And I still
Which
feel
is
that
why
way.
I'm like, the doctor, it's not that important to me, because
As long
what
as you
money is going
pay
to
me for my PhD, like, we're good. But no, but seriously, now as I've gotten older in it, and like the blood, sweat, and tears and the sacrifice that I've made, um, I still feel you can definitely call me Kiiyonna, but I think I'm getting older, and now I'm like, I think it does set you apart. It's like,
yeah.
it's not just, I'm not just Kiiyonna, I'm Dr. Jones. Like, I've really spent a lot of time getting to the place where I have a terminal degree, and like, I want to be acknowledged for that. And so yes, pay me, but now acknowledge that what my hard work and effort. But I guess then where I kind of struggle with is like the nursing programs period. And I've spoke about this too. It's like, we have to be careful when we have all these programs popping up all over the place, because what we can do is open ourselves up for scrutiny. And then you got like, you can't go to medical school online. There's no online medical school program. And I feel like, and this is something that some people are not going to agree with me on. I mean, it's just how I feel. I feel like that some of it can put us at risk as a profession. Because not that I have a problem online, nothing like that, but it's like when we're trying to push and have the same title, we should have, the playing field has to be fair. Like, if we are able to go and get a degree in 2 years and be called doctor, and they have to go 4 years in person and they can't be online, all these rigorous hours. And we want to be called the same thing without any scrutiny, like, or without any differentiation. I feel like it could affect us down the line because although through technology and over time, nurses are now able to do a lot of things that doctors are able to do. We got CRNAs, we got, FNPs, we got mental health, primary mental health nurse practitioners. Like, so we're kind of entering into their space, but they have to do a lot more work. And I think some of them may feel that, all of this, same thing to what I was just speaking to earlier, like all of this hard work is just like gone. Like it doesn't matter because you can go to school for a nurse and get it in half the amount of time and do it online. So, and not to mention the time, like in nursing school, like I'm sorry, like FNP school or something like that, people can go straight from nursing school straight and may not have even taken care of a patient. And so we potentially could, like, when you think about it from a larger scale, it could put us in a position, the implications of that will make them question us as healthcare professionals. And so I know y'all probably listening and like, oh no, she did. But I'm sorry, y'all. I mean, I guess I'm now an old school nurse because I'm talking. But no, but I do think about that on a broader scale. And I'm like, do you really want them to with a microscope? Because maybe what'll end up happening is now the program needs to be I went to my PhD program. I was 4 years. Okay. I didn't have a 1-year program. It was 4. Right. So I think it's going to open us up. I think it's going to be great for us to have conversation. I do feel like the healthcare climate is changing though. Like they're realizing it doesn't take all of that to be a primary care. Like you can really do it as a nurse and have great results and have outcomes that are beyond, even higher in some cases than doctors as a nurse practitioner. I get that. But when we're fighting, we just got to be careful. That's all I'm saying. It opens us up to scrutiny.
Yeah, and that makes me think of because I definitely understand that, especially looking at the nursing practice different and seeing how we're so much our programs are different and they don't hold up to some other professions in a sense that we can go get our BSN in 8 months or we can go get this degree really quick. And same for me. I went online to online school and did my clinicals that way. Did I think it was the best? No, but that also makes me think of how there's a shortage of doctors and how now they're saying med school is too long. You don't need all that. Why can't we combine it? Because they were saying how they're going to start letting doctors come here and practice from other state or from other countries without, I guess, going through medical school again. And it makes me think of now how they're trying to shorten the doctor's road to pretty much do the same thing because there is a shortage because people are seeing it's a lot of money to go to med school. It's a lot of time to go to med school and people just aren't willing to do that as much these days as they were before. So the landscape is changing.
It is.
For both sides.
Yeah. And so what it does is I'm hoping that this will open up the dialogue and we can really, because I don't like, and let me be clear about this. I don't like that there are so many different ways to get a certain degree, like especially when you get to the advanced practice level, like there are, like you could go to a program that's 12 months, you can go to a program that's 24, that's 36. Like we need to have some standardization. If you know you're going to medical school, it's 4 years, period. And then when you complete, you go to residency, internship, and then residency, depending on what your specialty is. It is very standardized. We don't have that. It's so many, depending on where you go, all this. And I'm hopeful that it's going to open up that type of conversation where, we are able to have some type of standards. They only do that for us in nursing because it's us. There is no way this would be accepted, like I said, in the medical field. No. Dentistry, no. So if we want the equal title because we've earned it, then we have to be open to the scrutiny that's going to come along with this, which it will be. and be okay with the necessary changes so that we can be respected. I've always, and that's something that I learned this when I was in my PhD program from one of my professors. She was like, we will never be respected until we have to get some kind of standardization in our education as far as nurses. We don't have that. It's just all over the place. People can pop up with a nursing program easily, right? They can't do that with a medical school. You can't do that, right? So yeah, I again, I'm happy that they're open in dialogue. California, we know, is one of the most difficult states. I don't know how this is going to pan out. I'm excited to see, because we're also going through that transition here where we are a transition to practice. Like, we're not full practice, we're in between. I know the medical board is fighting really hard to hold on to their top spot, but I feel like there's a lot of other professions that are definitely, I mean, in healthcare, that are coming for them.
For sure.
Easily.
For sure.
Yeah. So I don't know what you think the outcome, what do you predict the outcome will be for this?
I predict that they allow us to use the word, but we have to make a clear distinction of our title. But I'm not sure if how does the California law state now that we cannot use doctor at all, or we have to?
So the board, so I was doing some research, and we use Board of Professions, BPC, the Board of Professions Code. And okay, it's exclusively owned in clinical practice, the word, and it's not owned, but it belongs to medical doctors, they say, in clinical practice. And so I've always thought that as long as you were clear on your certification, that you could still be called doctor in a clinical setting. But according to what I've been researching, is no, not in California, you cannot. So I think that, because the medical board has it on wrap, but we see it's changing, because they did not want us to even be in transition to practice. Like, they don't even want us to get to a transition to practice state. They want to keep it on lock. But I just feel like we are being more respected now. And a lot of doctors are even speaking up. The millennial, like the younger doctors are coming in saying, no, like, nurses, they saved my butt. Like, many a times, so they're able to speak to the credibility and the value that we provide. So I agree, like you. I think it's going to be a long process, but I don't think ultimately doctors are going to be able to own it. And they do have a valid position saying that, what about all these other specialties, like physician, physical therapists? They have to have, they have their doctorate. Like, there's a lot of different specialties, and I get it. Like you said, nurses and doctors work closely together, but I think at best we'll end up like Georgia, where it's just, you can be called doctor, but it just needs to be a clear distinction between your actual certification. So
yeah, with how the tide is changing and how we did just get, or we're in transition to practice, I think that they would have to, or I would like to think that they would set some sort of precedent and be like, okay, this is where we're going. So we have to give them the respect that they deserve in doing so, because the truth is, like, it's there. It's DNP is now a practice, so it's there. What are we going to do about it? Like, we have to address it, clear it up, and then move on. Because we have shown that, as nurse practitioners, DNPs were definitely needed in the space to help, bridge the gap. So we have to get some.
And here's the thing, you guys, we have to remember, like, nurses were created, like, the position was created to help doctors. That's it. We were just helpmates of doctors, right? And so now we're breaking away from this marriage, and we are starting to form our own identity, and we're starting to be in our own right, and we're dominated by females. Like, it's a woman dominated profession. And I think all of those moving parts have a influence on what's happening right now. Historically, where we've come from, it was never a part of the plan for us to get degrees, and like it was just a training. Like you would literally train on the job and learn how to assist the doctors based on the doctor's his or her practice. It was never for you to be this independent and start even doing some of the things that they do. So I think that is the big issue. And so I think because we have new generation of doctors, because we have new generation of nurses that are standing up for themselves and doctors that are really supporting us in the journey, I do think it's going to be a change in California and even maybe nationally. So
yeah.
Looking forward to that. So we'll see what happens, you guys. We just wanted to come on and give our little 2 cents about this trending topic, especially as it pertains to our profession, especially with us being entrepreneurs now. Like, you know, we really truly
do that to leverage our degrees for.
Exactly. That's another thing. They're not happy about that either. So, but you guys, Christal, we're going to head out now. I guess that's it. But as always, you guys, don't gatekeep. If you have nurse practitioner friends or anyone who you think can benefit from our podcast, make sure you share. Let them know that we exist. So, okay, you guys, until next time, see you soon. Bye.